All right, party people. Today, we're going to be covering what to do or how to think about or how to understand if the Usmle gives you a patient with a severed pituitary stalk and how that would relate to hormonal changes in a patient. They might ask you a question like, oh, a patient's pituitary stalk has been severed, and then ask which of the following hormones would be increased or which one of the following hormones would be decreased. So let's run through it. This is basically a review of physiology. So, for example, ACTH is produced by the anterior pituitary in response to CRH, corticotropin releasing hormone, from the hypothalamus. Now, if the stalk was severed, CRH can't reach the anterior pituitary, so ACTH levels would fall, CRH levels would increase. The same pattern would apply to the following hormones, such as FSH and LH. They require GnRH from the hypothalamus. Therefore, FSH and LH would decrease, while GnRH would increase. Growth hormone also would decrease because it's stimulated by GHRH. The same for TSH. TSH would decrease and TRH would increase. So cutting the pituitary stalk cuts off hypothalamic stimulation. Levels of ACTH, FSH, LH, GH, and TSH all decrease. So the odd one out here is prolactin. And this is really the key point for this entire question. Prolactin is normally under inhibitory control from the hypothalamus through dopamine. Please understand that dopamine inhibits prolactin secretion. This is an active inhibition that's constantly ongoing. Therefore, D2 antagonists like haloperidol, aripiprazole can cause hyperprolactinemia. They're blocking the inhibitory effect. If you block the blocker, you're basically stimulating. Also, if the pituitary stalk is severed, dopamine can no longer inhibit prolactin secretion. Therefore, prolactin levels increase. And this is quite similar to what happens when you give a D2 antagonist. On the flip side, when treating prolactinomas, standard therapy is a D2 agonist like bromocriptine, which restores dopamine's inhibitory effect and reduces prolactin levels. So the bottom line is when severing the pituitary stalk reduces the stimulatory input from most anterior pituitary hormones, causing their levels to drop. But prolactin increases due to the loss of dopamine because the loss of dopamine removes its normal inhibition. All right, that's it for this one. Go crush it.